Ladies and gentlemen, the story you are about to see is true.
Not surviving. The consent has to be written. There was no consent, either the document or any evidence of a process of informed consent.
What is meant by a patient's right to autonomy as it relates to informed consent?
Your body is your own. Your life is your own. And you have the right to autonomy, to dictate what happens to your body and your life. That is a fundamental human right. Informed consent is medicine's way of respecting your right to autonomy, your right to make those decisions that are important and will affect your body and your life. Autonomy is a fundamental principle in ethics. And physicians, nurses, hospitals, healthcare institutions all recognize the patient's autonomy, the patient's right to make these decisions through the process of informed consent. The lack of informed consent denied Michael Jackson autonomy.
And would that informed consent, in this case, under these facts, include the requirement that Dr. Murray tell Michael Jackson, in no uncertain terms, that he may die as a result of what was taking place with the propofol?
Yes. I tell patients when I take care of them that there is a possibility of severe adverse events. And that's in the best of circumstances, and that includes the possibility of dying. That's part and parcel of the anesthesia consent process. This case being many orders of magnitude different because of the environment, the doses, the lack of competence in either managing sleep disorders or these drugs, placed Michael Jackson at huge risk, and there's no evidence that that was disclosed.
And when you talk about the right to autonomy, and you previously talked about the doctor-patient relationship, you're not saying that the right to autonomy would allow Michael Jackson to insist on propofol, with the result being that Conrad Murray then has an obligation to provide it, are you?
A doctor's obligation is to put the patient first, which requires the exercise of judgment, requires saying no when it's appropriate. Saying yes is not what doctors do. Doctors do what's best for the patient.
And the denial of autonomy, the denial of allowing the patient to be fully informed about, in this case, the risk of death, that's one of the reasons you found it to be both an egregious and ethically unconscionable violation of the standard of care?
Yes. Every night there should have been a consent, an informed consent, a written informed consent for the sedation every night, because it's a new procedure. And by not obtaining it, Michael Jackson was denied autonomy, denied the right to know the likely consequences, and to, for him, Michael Jackson was denied his right to make an informed decision.
You next talked, Dr. Schaefer, about the requirement that Dr. Murray continuously observe the mental status of Michael Jackson. And you found that to be, again, an independent, egregious violation. What do you mean by the need to continuously observe the mental status?
When I am providing sedation to a patient, I'm right there. And I'm able to converse with the patient while they're getting sleepy. It may be that they're not fully asleep, and then I can chit-chat with the patient. I can talk with the patient. If the patient is at all uncomfortable, I'll say, oh, that's a little uncomfortable. Okay, I'll give you something more. But I'm right there with the patient, assessing the mental status, assessing how awake they are, how comfortable are they. And in the case of using these drugs for sedation, we're not looking for unconsciousness. We're not looking for general anesthesia where you can cut a person's body open and not have them respond. We're looking for a amount of drug effect, the power of the drug. We're looking for an amount of drug power here that is just enough to have the patient where they need to be and not more. But to give just enough drug and not more, you have to know where you are. You have to know how sleepy the patient is and whether or not they need more drug. And you stay right there with them at the head of the bed.
And in your opinion, did Dr. Murray violate this fundamental requirement for the safety of the patient?
Yes.
And would you characterize it as Dr. Murray having actually abandoned Michael Jackson?
Yes, he walked out of the room.
You gave an analogy in your April 15th report of someone driving a motorhome down the street. Can you describe that and relate how that applies to this case?
Absolutely. An anesthesiologist or a physician giving sedation is responsible for driving this case, like a person driving a motorhome. The person's on the freeway and is driving a motorhome and decides their bladder is full and they need to leave. You don't just get up from the steering wheel, walk back to the bathroom, relieve yourself, and come back 2 minutes later, because it's very likely there's going to be a disaster. Because you're the driver and you're responsible for steering that motorhome on the freeway. And no matter how full your bladder is, you don't leave the steering wheel. Dr. Murray left the steering wheel.
In a setting where propofol is being administered, obviously you would have backup personnel if it was done properly, correct?
Yes.
And that would be one of the reasons, for example, a restroom or some type of need to leave the room.
In 25 years of giving anesthesia, I have never walked out of an operating room with a patient receiving an anesthetic drug, nor do I believe have any of my colleagues ever done that. I might, if I need to leave for some reason, another colleague will come in, and I'll give them a report, tell them what's going on, show them the vital signs, show them the drugs that are running. I'll say, I'll be back in a few moments, and I'll step out. And then I'll come back, and they'll tell me what happened while I was away. But not once have I walked out of an operating room with a patient receiving drugs, nor have any of my colleagues, to the best of my knowledge. Doctors don't do that.
Now, you talk about physically walking out and abandoning Michael Jackson. You also reference the period of phone calls that take place as evidenced by the cell phone records. Is that also, even assuming, let's assume Conrad Murray was in the general vicinity of his patient, is being on the phone in that manner with no other backup personnel independently an egregious violation and a form of abandonment?
Yes, it's a setup for disaster. A person receiving intravenous drugs. The healthcare provider is not at the steering wheel. They're not focused on the patient. Instead, they're talking on a cell phone, sending text messages, answering email. You can't multitask like this, even if you're a couple feet away, particularly because from a couple feet away, with no monitors in place and no alarms, a patient who is about to die does not look all that different from a patient who is okay, because nothing's happening. And you don't know that the oxygen saturation is dropping, and you don't know that breathing has stopped, because you're distracted while the patient is essentially dying. So you have to be right there. You cannot be distracted with all these other activities. And a period of 45 minutes, I think, speaks, that may be the wrong number, but that period speaks for itself.
You're referring to the phone calls?
Yes.
And what did you mean, or could you elaborate on the statement you just made about the patient might not look much different from presumably being okay to being in serious risk of apnea or death?
From a distance, it's not that easy to tell if a person who's lying down in a bed is breathing. All that happens is the stomach rises and falls a little bit. And from a distance, You can't tell if a person is breathing or not. At least I can't. But that's the only thing that Dr. Murray had to look at from a distance. There were no monitors, there was no blood pressure. You can't see this little device on the finger that measures the oximetry. From a distance, Michael Jackson lying there not breathing doesn't look very different than Michael Jackson lying there breathing. And Michael Jackson could stop breathing for a considerable period of time and not have it be obvious to a person standing at a distance without monitors in place. So the possibility of occasionally looking over, seeing Michael Jackson, yeah, everything looks okay, when everything is very much not okay, I actually believe that is what happened.
Dr. Schaefer, you also talk about, as it relates to observations, that there's the independent need to make constant observation and continuous observation of breathing, which you just touched on. And again, can you describe for us the need for that and why you found that, again, independently was another egregious violation in the standard of care?
Correct. Earlier when I spoke, I was talking about the need for monitoring carbon dioxide, the need for monitoring these. But it has to be done continuously. It's not just that they weren't present. It's that even if they had been present, it has to be continuously checked. It has to be followed every few minutes for something like blood pressure, or every few seconds like carbon dioxide and oxygen saturation in the blood. So there is a need not just to set these things in place, but to observe, to watch what's happening to the patient. And that is a different, egregious violation. That continuous observation was not made, as evidenced by Conrad Murray's leaving the room and evidenced by a long period of phone calls and other distracting activities. And the outcome, Michael Jackson's death, is an expected consequence of failure to continuously monitor the patient.
It's easy to resuscitate Michael Jackson, assuming Conrad Murray is telling the truth that he'd only been gone for 2 minutes and found him not breathing, correct?
That's correct.
Okay. And tying that in to this need then to constantly observe the breathing, let's assume a competent doctor did constantly observe the breathing, and again, there was some sort of airway obstruction where the tongue fell back or something of that nature. Would you characterize the subsequent resuscitation to be, from a medical point of view, relatively easy in nature?
Yes. Yes. May I elaborate?
Please.
I have patients that stop breathing every day. When you induce anesthesia for surgery, we give doses so large enough that every patient stops breathing. It's just routine. Happens every day. It's no big deal because I know what to do. And I breathe for the patient for a few moments, and then I do something like either the laryngeal mask airway or the breathing tube that goes into the trachea to move air in and out of the patient. So every day I'm in the operating room, I have patients who stop breathing. Completely expected, completely normal and routine. And it's no big deal because I'm right there. I know it's going to happen. I'm giving the drugs. It does happen every time. I move air for the patient, and then I make some intervention so that there is a continuous flow of air to the patient. If Dr. Murray had been at the head of the bed, been next to Michael Jackson, and saw Michael Jackson stop breathing, he would simply have opened up the route for air, either chin lift, something simple, or perhaps ventilate Michael Jackson's lungs with that mask and that squeeze bag that I showed you. And nothing would have happened. There would have been no adverse outcome at all.
And we'll be taking about 10 or 15 minutes.